ideal BMI range. So, as I am conducting this seminar, so it is important to my audience that they know that what are my qualifications and how much I was qualified. Actually, I certified nutritionist and health coach. My qualification is MSc microbiology. Then I have completed MPhil microbiology. Then diploma in applied nutrition, food science, and ethics. And now I am pursuing the diploma in functional medicine. This is going on next 2 to 3 months. I will get complete this. And about my health history, as I told that I was very unhealthy with respect to my weight, and I was obese, diabetic. My HbA1c is 6.3. My lipid profile is very much elevated. Low vitamin B12, and I'm complaining mostly about the pain in my legs. When I approached the doctor recommended me the medicine that is the rosuvastatin for the high lipid profile and B12 supplements, and for the diabetes they recommend me metformin 500. But I there so see my reports. These are the reports which are on 13 Jan and 3 May. After more or less 3 months, my H1 is 6.3 and range of diabetic is 6.4. So I am about to diabetic. If this cross the 6.4, then I am in the range of diabetes. Then I followed the balanced diet and my H1 is get reduced and is 5.8. The non-diabetic range is 5.7. So I am more or less in the non-diabetic range. And this is my lipid profile. You see here the triglyceride, that is a 435. But when I followed the balanced diet without any medication, without any supplementation, I have reduced my triglyceride about 50% in just 3 months. And this is the 200. And you can see the LDL level, which is the bad cholesterol, that was 169, that is elevated from the limit. And now this is 133, somehow within the limits or within the range. And remaining markers are also within the range 237. There is a drastic change in the parameters after just following the good lifestyle as well as the diet. So how this is possible? Now the question arises, how this is possible without medicine? Is it possible that we can control the diabetes and dyslipidemia without medicine? Then answer is yes, and the answer is balanced diet. So the question is, what is balanced diet? Eating wide variety of foods, right proportion, right amount of food. Actually, wide variety of foods. When we will talk about the wide variety of foods, we will talk about the different food groups. For example, vegetables, we will talk about the fruits, we will talk about the grains, we will talk about nuts, we will talk about the good fat as well. One diet is not applicable for all person. Actually, when we go to the social media, there are so many influencers who tell that you eat this and you can control the diabetes, you can control the dyslipidemia, BP, sugar. But remember one thing, that one diet is not applicable for all persons. Everybody is different. Every individual is different. Their needs are different. Their genetics are different. Their microbiota is different. Everything is different. So the eating patterns are different. So we cannot follow blindly the diet which is good for other. So as per the Indian Council of Medical Research guideline for a balanced diet, our plate should be like this. Means 50% part of our plate should be vegetable and fruits. But nowadays, if you look our plate, then the grain portion is more than the vegetable and fruit portion. If you look about the plate, actually we Indian think about the how many chapati we eat. We don't think about that how many sabji we eat. Everyone asks that this person is eating only the 2 chapatis or 3 chapatis, and no one worried about that how many fruits or how many vegetables he eat. So you see here the oil part is very low, nuts and seeds, and grain part is only about the 25% of this plate. And milk is the part of the balanced diet. And here, this is the pulses means protein part. This is the protein part, this is the fat part, this total invisible and visible fats, and now this is the grain part. Grain includes all the whole grains, as well as the millets, as rice and wheat, etc. So this is our balance plate. If we'll follow this balance plates as per our VMR, then definitely this is a healthy, and this the person will be healthy. So tips for healthy eating, how we have to eat the things. Learn simple ways to prepare the food. Don't process the food. Actually, the meaning of processed foods, that when we prepare the food at home, there is a multiple steps we include in the food. For example, we prepare a dal, simple dal of any type. Then we take the tomato, we cut this and churn on this oil. Actually, this is not the right procedure. This reduce these steps of processing of food reduce the nutrients content of that particular, you can say, the pulses as well as in the vegetables, etc. Stop eating when you feel full. Actually, we eat as per our taste, not as per the requirement. So, stop eating when you feel 70% full of your need. Drink a lot of water, keep water bottle pretty. It is better habit that we will keep ourselves hydrated throughout the day. It is better habit. It is a good habit to keep water bottle near you. So this is a reminder that you have to drink the water. Eat fruit and vegetables every day, preferably seasonal and local. So preferably take the fruits and vegetables which are available in your local market. Don't use the fruits and vegetables which are off seasons. For example, nowadays cucumber is now the off season vegetable, and in salad we preferably use the cucumber, but instead of cucumber we have to use the radish as well as the carrot and chucandar, which are the seasonal fruits nowadays. Limit alcohol and sugar. So this is obviously we have to limit the alcohol as well as the sugar. Don't force yourself to eat things because they are good for you. Some I have seen more of the people that after lunch they eat the fruit. Actually, you are getting the full after completion of the lunch, but they are eating the fruit because they think that this is good for you, yeah, or good for him. But this is not a good strategy or good approach, that after getting the full of your stomach, you are eating the things that they are good for you. Some people eat the good, very jaggery after taking the meal. So this is also not the good habit, because sugar is the jaggery is the refined sugar. It is the total sugar, and this spike the glucose level in your blood, and addition of extra calories. So what are the myths? All carbohydrates are bad. This nowadays in social media you see that don't eat the carbohydrates, you have to take the protein. Protein become the hero, and carbs and fats are the, and nowadays are the villains. But this is not the true. In a healthy diet, carbohydrates have the same role, even though in a balanced diet you can see the carbohydrate contribute about the 60%, and 20% is the protein, and 30% is the maximum limit of the fats. So this is not the true. All fats are unhealthy. This is also not the true. Fat is very essential for us for the you can say vitamin D. Vitamin D is a fat soluble vitamin. Without vitamin D, this is not possible to utilize this vitamin D for our body. Diet or fat free foods are always healthy. I already told that this is not the true. You need to avoid eating after a certain time, like 6 p.m. This is not this is a generalized statement actually. So that means that after dinner, avoid the eating anything, or even the late night. Eating only salad is healthiest way to maintain a healthy weight. This is also a myth, that diet nowadays, diet means eating salad, but this is not the true. You have to eat each and everything You have to eat fats, you have to carbohydrates, grains, everything. Skipping meal is a good strategy nowadays. If every person is like that, I want to skip. I have to skip the dinner. I have to skip the dinner for weight loss. Actually, this is not a good strategy because when you are skipping a meal, you are also skipping some of the nutrients which are essential for your body in day-to-day life. So these are some of the myths. And now the diabetes. Actually, in India nowadays, every second or every third person you hear that he is diabetic. So there are two type of diabetes: diabetes one, type 1, and type 2. Actually, type 1 is a autoimmune diabetes where your pancreas is destroyed by your bodies and they are unable to produce the insulin. So I will not discuss here the type 1 because I'm not authorized to handle this. This is a more critical type 1 diabetes. And now the type 2 diabetes. Type 2 diabetes is the condition when our body is unable to utilize the glucose or utilize the sugar. Our pancreas is functioning well, is releasing the insulin, but our body is not utilizing this. So this is we will discuss here the type 2 diabetes. So for normal person, how we can say that this is a normal person and he's pre-diabetic or diabetic. If the fasting sugar is 70 mg per dl to 99 mg per dl, then this is called as the normal person. HB1AC, this is a 3-month sugar less than 5.7%. And next one is pre-diabetic, means the person is not normal and not the diabetic. Means this is the stage when we can reverse this diabetes with the help of balanced diet, exercise, or lifestyle change. So fasting sugar 100 mg per dl to 125 mg per dl. HB1AC 3-month sugar less than 5.7 to 6.4%. Now, the diabetes. Fasting sugar more than 125 mgdl, HbA1c more than 6.4%. So when you are become diabetic, then you can reverse this diabetes, but it becomes somewhat more difficult and it will take more time. But when you are pre-diabetic, you can reverse this diabetes very easily with the help of any of the professional. So main cause of type 2 diabetes, excess body weight, obesity. As I show you my photo earlier that there is a so many fat on the stomach area. So this is a major cause, obesity and body weight, especially for the abdominal area for the type 2 diabetes. Physical inactivity, as we nowadays based on the lifestyle we are very inactive nowadays. So physical inactivity, genetics is also play a role, but genetics is not the destiny of that you will be a type 2 diabetic patient. Fat stored around liver and pancreas means fatty liver. Fatty liver also contribute for the type 2 diabetes because many of risk factors are modifiable. Listen this carefully. Because many of the risk factors are modifiable: weight, activity, and diet. Type 2 diabetes is considered largely preventable or delayable. So we can reverse type 2 diabetes with proper guidance or under the guidance of any of the health professional. Can your doctor reverse the diabetes? No. If this is the way that doctor can reverse the diabetes, then there is no problem with the diabetes because doctor is recommending you medicine. You are taking the medicine, but after some time he increase the dose. If he's controlling the diabetes, then what is the need to increase the dose? But this is not the reason. At the end of the after long time, person will come on the insulin even though. Then how this help? How this will happen? If a doctor is not able to control or reverse the diabetes, then how you can? So then how diabetes reverse? Lifestyle change can help to manage and reverse the diabetes, balanced diet and exercise. Who can help? Now, lifestyle change. Now, what are the changes you have to do, with your life? So who will tell you how you came to know? Actually, in social media and YouTube, there are a number of videos, and they so you totally get confused. So Now, who can help you? A registered dietitian or a certified nutritionist, means a health professional who know the food science, who knows about the diabetes and how functional food, even though functional medicine is actually not a medicine, but how we can utilize food as a medicine. So this is the functional medicine approach. So here you can see this picture. Pre-diabetic is a tension because you are going to be a diabetic if not you have not done any changes in your lifestyle. So if you are pre-diabetic, you have worry, but after if you are following the proper procedures and you got the non-diabetic, then you can enjoy your life in old age. So these are our services. LifeRx Nutrition Services. Life Nutrition offers weight gain, weight loss, diabetes management, thyroid management, CVD management, gut health, and balanced diet. So I think 10 minutes are left for this meeting. You can ask any question, Mr. Varun. Thanks.